and I'm going to present the topic Nano-Theranostics, a clinical weapon of new medical era. Many people get wrong diagnosis and poor prognosis, or in the worst cases, no diagnosis at all. To overcome this issue, there is a new technique that is theranostics, which can perform the combined function of diagnosis and therapy. The idea behind theranostics is to combine drugs and techniques to treat and diagnose various medical conditions and monitor the response of patients. It can help in many diseases like neurological, diabetes, and particularly cancer. Cancer is the second most leading cause of death, and among cancers, lung cancer is the second most prevalent cancer according to the prevalence given by World Health Organization. This field has wide applications means patient stratification, drug release monitoring, imaging based focal therapy, and post treatment response monitoring. By combining nanoparticles with theranostics, it becomes nanotheranostics, which is an innovative tool and attracts the attention of researchers. The structure of next generation nanotheranostic particles contains four main components. Here you can see the structure. Number one, the therapeutic payload means therapeutic agent, for example, anti-cancer stem cell drugs. Number two, imaging agents that provides multifunctional images and enhances diagnosis. For example, organic fluorescent dye and quantum dots. Number three, carriers or vectors that provide protection for therapeutic and imaging payload and release the drug in a controlled manner. For example, gold nanoparticles and liposomes. Number four, targeting moieties, decorating the surface of nanoparticles that aids in targeted drug delivery. For example, peptides, antibodies. Now come towards that how the weapon of nanotheranostics can help in fighting against cancer. It can help in precise diagnosis and can tell us about the depth and location of tumor mass. Therapeutic moiety can cause induction of cancer stem cell death. Carriers or vectors help in controlled release of drug. After performing its function, it is degraded in the body and excreted in the urine. Nanotheranostics in lung cancer. Lung cancer is the leading cause of cancer related deaths worldwide. In one of the latest researches, an allotinib based nanotheranostics was introduced in mice. It successfully reversed the resistance of epidermal growth factor receptor wild type to allotinib. The combination of allotinib with antivascular endothelial growth factor could be a potential combinational regimen. At last, I would like to say that it can accomplish the aim of three P's, means personalized therapies, pre-selection or non-invasive imaging, and can predict the response of patients. Here are the references from where we have taken the material. Thank you so much.
टाइम 19 पे है ठीक है
चले
Assalamu alaikum. I'm Abida Sabir, roll number 6616 from 5th semester. Our topic is post-traumatic stress disorder. Basically, it is due to very stressful or frightening events. It's the most common in our society. Now, talk about the statistics. 15 million people are worldwide mostly affected by PTSD, out of which 1.5 million in Pakistan are affected by this. And its death rate is 45%, and it is increasing day by day. Out of 13 people, one is affected by PTSD. Women are mostly affected due to 50% rape cases due to distrust issues. Due to PTSD, some types of changes are occur in our body, like physiological changes and psychological changes that related to our psyche, and physiological changes that related to our body. And now we talk about our slogan, that is don't wait until you break. It means कि जब ये सिम्टम्स आपको शो होते हैं, अगर आप इनको कंट्रोल नहीं करते, अगर आप इसको अपने किसी थेरेपिस्ट के साथ, अपने डॉक्टर या फिर किसी साइकियाट्रिस्ट से आप इससे कंसल्ट नहीं करते, तो ये मोर डिसऑर्डर्स में कन्वर्ट हो सकती हैं, जिससे आपकी लाइफ जो है वो थ्रेटन की तरफ जा सकती है. इट मे दैट्स व्हाई वी सेड डोंट वेट अंटिल यू ब्रेक. और इससे जो कॉम्प्लिकेटेड डिसऑर्डर हो सकते हैं उसके अंदर डिप्रेशन है, हाइपरटेंशन है, सब्सटेंस यूज डिसऑर्डर है, सुसाइडल अटेम्प्ट्स है 54%. दैट्स व्हाई इसको कहा जाता है कि जैसे ही आपको इसके सिम्टम्स शो हो, इसको फौरी आप किसी डॉक्टर या किसी साइकियाट्रिस्ट से कंसल्ट करें. Now we talk about the treatment. We can treat it in two ways, like psychotherapy and pharmacotherapy. Psychotherapy is the first line of therapy. इसके अंदर क्या होता है, prolonged exposure therapy के अंदर क्या होता है, आप साइकेट्रिस्ट आपके साथ जो ट्रॉमेटिक इवेंट है उसके बारे में आपको डिस्कस करता है, जो आप जिसके बारे में आप अवॉइड करते हैं, आप उसे डिस्कस नहीं करना चाहते. अब इसके अंदर दूसरा जो है वो है फार्माकोथेरेपी. जो पेशेंट साइकोथेरेपी को नहीं करते उसको प्रेफर करते हैं फार्माकोथेरेपी की. उनके लिए क्लासिकल वे में भी और नोवल थेरापेटिक अप्रोचेस वे में भी थेरेपी प्रेजेंट है. क्लासिकल वे के अंदर जो है वो SSRIs इन्वॉल्व है, सिलेक्टिव सेरोटोनिन रिअपटेक इनहिबिटर्स, जिनके अंदर पैरोक्सिटिन एंड सर्ट्रालिन जो है वो FDA अप्रूव है, जो कि हमारे सेरोटोनिन के लेवल को ब्रेन के अंदर बढ़ाती हैं और हमारे मूड एंड बिहेवियर को कंट्रोल कर लेती हैं. सेकंड वन जो कि रिसर्च ट्रायंगल इंस्टीट्यूट ऑफ यूएसए एंड नेशनल इंस्टीट्यूट ऑफ हेल्थ ऑफ यूएसए के अकॉर्डिंग हम लोगों को दो इंफॉर्मेशन मिली है, जिसके अंदर एसटीबी इंजेक्शन एंड केटामिन आईवी इन्वॉल्व है, जो कि नोवल थेरेपेटिक अप्रोचेज हैं. एसटीबी क्या होती है, सेटेलाइट गैंग्लियन ब्रोकर, जो कि हमारे यहाँ लंग के लोअर रीजन के अंदर सेटेलाइट नर्व्स होती हैं जो कि फाइट एंड फ्लाइट कंडीशंस को कंट्रोल करती हैं. सिंपैथेटिक नर्व्स होती है. जब भी डिसफंक्शन होता है पीटीएसडी के अंदर, ये डिस्ट्रेस सिग्नल हमारी बॉडी के अंदर सेंड करना शुरू कर देती है. दैट्स व्हाई हम इनको डायरेक्टली ब्लॉक करते हैं इंजेक्शन के जरिए. सेकेंड वन इज केटामिन इंजेक्शन. हम दो ग्रुप्स के अंदर जो है हम लोगों ने इसको अप्लाई किया. ज्यादातर ये जो है सोल्जर्स के अंदर देखा जाता है, क्योंकि सोल्जर्स के अंदर जो ज्यादातर वो स्ट्रेसफुल इवेंट्स में एंगेज होते हैं. दैट्स व्हाई पीटीएसडी की जो परसेंटेज है वो ज्यादा होती है. हमने उनके अंदर एक्सपेरिमेंट किया जिनके अंदर केटामिन जो हमने इंजेक्ट किया था वो उनके सिम्टम्स भी प्रूव हो रहे थे. दैट्स व्हाई केटामिन करता क्या, ये ग्लूटामेट रिसेप्टर्स को ब्लॉक करता है. ग्लूटामेट जो एक्साइटेटरी न्यूरोट्रांसमीटर है हमारी बॉडी के अंदर, जब भी इसकी एक्साइटोटॉक्सिसिटी होती है तो स्ट्रेसफुल जो सिम्टम्स है वो पेयर होना शुरू हो जाते हैं. केटामिन डायरेक्टली जाकर उन रिसेप्टर्स को ब्लॉक करता है. जहां पे ग्लूटामेट बाइंड नहीं करता, हमारी बॉडी के अंदर जितने भी सिम्टम्स हैं वो सारे के सारे स्ट्रेस के सिम्टम्स इंप्रूव होना शुरू हो जाते हैं. Thank you.
I'm Ravajun, double six here from Princeton to Pharmacy, and I'm here to talk about some facts and innovation pharmacotherapy tuberculosis. First of all, what is tuberculosis? It's an infectious disease that is caused by Mycobacterium tuberculosis, and it's a bacillus bacteria. And why I chose this topic is because it's the second most prevalent disease after COVID-19 and HIV, and it's the second most leading infectious disease killer in the world and killed about 1.5 million people in 2020. So it kills one person each 22 seconds. So it is highly deadly disease, but it doesn't mean it is not treatable. It is preventable and curable. For prevention, there is some drug preventive treatment and vaccine like BCG available. BCG means Bacillus calmette urine. Now, how it is separated? Separates the air, goes into the pulmonary alveoli, invades alveolar macrophages and causes infection over there. And it really can enter into the bloodstream and cause infection in the other parts of the body like brain, bone, kidney, and peripheral lymph nodes, etc. Now, coming to the symptoms, towards the symptoms include cough that persists for at least 3 months and cough with the blood, fever, fatigue, redness, itching, chills, running nose, etc., and lacrimation. And there is a flow of tears and night sweats particularly. If we see what a typical TB requires, it requires X-rays, lab tests, follow-up testing, and conducts and medication. Or you can say it requires diagnostics that include X-rays, CT scans, biopsy in very rare cases, bronchoscopy, some lab tests that include culture tests and some other tests like TB skin tests. And then there's the medication that are categorized into two: first-line treatment and second-line treatment. First-line treatment includes HREZ, that is isoniazid, rifampicin, ethambutol, and pyrazinamide. Now coming towards the main topic I want to discuss here is why there is a need of evolution in TB therapies. Actually, this is because the emergence of DRTB cases. What is DRTB? It's the drug resistance. If the mycobacterium that is residing inside the patient is resistant to the rifampicin, it is termed as DRTB. If it is resistant to rifampicin and isoniazid, also it is termed as a multi-resistant drug TB, MDR-TB. And if it further resistant to some other drugs like chloroclinin, it is termed as extensive drug resistant TB, XDR-TB. And what are the challenges we face due to the DRTB? This requires a longer medication duration, as you can see, from 9 months to 2 years or longer. Large dose, like 14,000 plus pills are required for the single patient. A low success ratio and strong financial aid. To overcome such challenges, there's been evolution from 1940 to till now. As you can see, in the recent past, in MDRTB required less than 1 year medication, and XDRTB required less than 2 year medication. And now in 2020, the medication duration for DRTB is reduced to 4 months only. Here are some drugs that are under investigation from 2016 to till now. These are PA824 citizolide, SQ109, AZD 58% dalaminine. These are the new chemical entries, and beta-catenin, limazolin, moxifloxacin, the older one. If we see the drugs that belongs to nitroimidazopyrin class, these are PA824 dalaminine. They actually show their action by inhibition of cytochrome oxidase, and they are under investigation with their role in MDR-TB. Then there is the oxazolidinone class drugs, and they show their action by the inhibition of protein synthesis. And then there is SK109 that belongs to ethylene diamine and shows action bactericidal action by inhibition of cell wall synthesis. Then there is beta-catenin and moxifloxacin that are the older ones, and are approved for the role in MDR-TB and under investigation for the role in DSTB. Beta-catenin actually shows action by ATP synthesis inhibition. Moxifloxacin shows action by topoisomerase inhibition. And then there's limazolid that belongs to the oxazolidinone class, and it shows action. It second line treatment, and its usage was limited because of its side effect profile that include optic and peripheral neuropathy and anemia, etc. And it is under investigation to lower its side effect profile. This was all about my presentation. Hope you like it.
Presenters are Myra Riaz and Mavish Khan, and the topic of presentation is formulation and evaluation of floating microcenters of famotidine. फॉर्मोटिडीन के माइक्रो कैप्सूल्स बनाने का जो है वो एम ये है हमारा कि हम जो है ना उसकी बायोअवेलेबिलिटी को इंक्रीज करना चाहते हैं। फॉर्मोटिडीन जो है वो मार्केट से जो है वो रिप्लेस हो गई थी क्योंकि इसकी बायोअवेलेबिलिटी कम है, और ये जो है ना इसका गैस्ट्रिक रेजिडेंस टाइम कम है। इसकी वजह से जो है ना वो हम सबसे पहले जो है ना हमने कभी भी गैस्ट्रिक अल्सर्स को जब भी ट्रीट करना होता है तो हम रिसेप्टर ब्लॉकर्स को जो है ना वो सबसे पहले स्टार्टिंग पे देते हैं, लेकिन अगर हमें लॉन्ग टर्म थेरेपी देनी हो तो फिर हम पीपीआईज की तरफ जाएंगे। तो इस वजह से फॉर्मोटिडीन जो है ना वो ज़्यादा पोटेंट और सिलेक्टिव H2 रिसेप्टर एंटेगनिस्ट है। तो हमारा जो है ना वो जो एम है, इसलिए हमने इसको जो है ना इस ड्रग को फोकस किया है अपने ड्रग फॉर्मुलेशन डिज़ाइन करने के लिए। हम माइक्रो कैप्सूल्स इसलिए बनाना चाहते हैं कि भाई इसकी बायोअवेलेबिलिटी ज़्यादा हो सके, और माइक्रो कैप्सूल्स का जो सबसे ज़्यादा मतलब एम जो यही होता है कि आप जो है ना उसकी कंट्रोल रिलीज जो है वो प्रमोट कर सके। अब हमने ना तीन ऑप्टिमाइज फॉर्मुलेशन जो है ना वो हमने डिज़ाइन की हैं। डिफरेंट रेशियोज हमने एक्सीपिएंट के और ड्रग के हमने यूज़ करके तो 3 फॉर्मुलेशंस बनाई हैं, जिसमें ना हमने सॉल्वेंट इवेपोरेशन टेक्निक जो है वो यूज़ की है। तो सॉल्वेंट डिफ्यूजन टेक्निक भी यूज़ कर सकते हैं इसमें ऑयल एंड वाटर इमल्शन बना के। तो इमल्शन जो है ना उसको उस पे से जो है वो सॉल्वेंट को इवेपोरेट करवा के तो फिर जो बाकी फ्लोटिंग माइक्रो कैप्सूल्स थे उनको हमने सेपरेट आउट करवा लिए। जो ये माइक्रो कैप्सूल्स होते हैं इनको हम कैप्सूल्स में भी हम मार्केट कर सकते हैं, और आगे हम अगर टैबलेट बनाना चाहें तो इसकी टैबलेट भी बन सकती है। फिर हमने इसके बाद जो है ना ये 3 फॉर्मुलेशन जब बनाई ना तो हम इसका चेक करना चाह रहे थे कि इसका रिलीज काइनेटिक्स क्या है या इसका रिलीज डाटा क्या है, क्योंकि हमने इसकी जो है वो गैस्ट्रिक रेजिडेंस टाइम बढ़ाया है, हमने इसकी यानी बायोअवेलेबिलिटी या डिसोल्यूशन ज़्यादा बढ़ानी थी। इस वजह से ना हमने डीडी सॉल्वर एक सॉफ्टवेयर है जिसपे हमने ना इसका इसकी वो चेक की है, डिसोल्यूशन चेक की है। अब ड्रग रिलीज डाटा हमने चेक किया है, तो इसमें जो F3 है ना, F3 ये वाली, ये जो रेड लाइन में है F3 ने हमें जो है ना वो एक प्रॉमिसिंग रिजल्ट्स दिए हैं, यानी ये सबसे ज़्यादा रिलीज काइनेटिक्स इसकी अच्छी थी। और फिर हमने इसका FTIR स्पेक्ट्रम भी किया है कि ये जो प्योर ड्रग है वो कितनी प्योर है ताकि इसके रिलीज डाटा में कोई इशू ना हो, और जो हमने ड्रग बनाई है वो बिल्कुल ठीक हो। अब डिस्कशन में यही है कि जो F3 हमारी जो फॉर्मुलेशन थी वो ऑप्टिमाइज थी, और जो है वो हमने यही है कि फॉर्मोटिडीन जो है वो इनकॉर्पोरेट हो गई है माइक्रो कैप्सूल्स में, जिसकी वजह से ना ये कंट्रोल रिलीज देगी और ओवर अ लॉन्ग पीरियड ऑफ टाइम जो है ना स्टमक के अंदर रिजाइड करेगी। इसका मकसद ये है कि जब कभी हमने कंट्रोल भी हमने लॉन्ग टर्म थेरेपी के लिए हमने जो है वो दोनों थेरेपीज भी देनी हो, डबल थेरेपी पीपीआई भी और H2 रिसेप्टर एंटागोनिस्ट भी, तो हम इसको जो है वो प्रेफर करेंगे, क्योंकि फॉर्मोटिडिन टैबलेट जो है ना वो हम प्रेफर नहीं करते क्योंकि उसका बायोअवेलेबिलिटी कम होती है।
Assalamu alaikum. My name is Maria Tahir and I will present the topic Precision Oncology Therapist. But first of all, introduction. It is defined as molecular profiling of tumors to identify targetable alteration, or it is an emerging approach for disease treatment and prevention. Here we take account the individual's variability in their genes, environment, and their lifestyle, their ethnicity, their gender, and so on. It is actually in contrast to one-size-fits-all approach in which disease treatment and prevention strategies are developed for the average patient. Here we tailor the treatment according to the patient's need. As it can be seen here that we have a group of patients, and we then did a study of molecular profiling, and then we categorize the patients accordingly, and then each group has different therapy they will be receiving. So actually this is the personalized therapy according to the patient's need, according to the patient's DNA profiling. So our objectives are to improve the efficacy, minimize the adverse effects, and overcoming the acquired resistance to the drug therapies, and as in case of conventional therapy. And we here we customize the treatment for the patients according to their needs. So these are 3 drugs which have been approved previously: Orgovex, Tabrecta, and Pimazide. I will be discussing the Orgovex. Orgovex is the first precision oral for advanced prostate cancer. So actually it was approved in 2020 under the license of Myovant Laboratories. It is how does it actually works? It suppresses the testosterone level, but how? Actually, it is a gonadotropin release hormone receptor antagonist. By antagonizing the effect of this receptor, it inhibits the release of follicle stimulating hormone and luteinizing hormone, which further decreases the release of testosterone, and this testosterone is actually involved in the progression of the disease. So we did a clinical trial study. It was an open label study, randomized. We conducted as 2-in-1 randomization. Total 934 patients were included. 622 received the Orgovex and 308 received the Leprolide. Orgovex dose is 120 milligram daily, but when we start the treatment, we give a loading dose of 360 milligram on the day 1, and in case of Leprolide, we give a subcutaneous injection 22.5 mg every 3 months. Then we assess the endpoint at the 48 weeks, and then later after 90 days we did a sub-study of testosterone recovery. Here in this graph, it can be seen that 97% of the men achieve the sustained testosterone level, while 88.8% patients sustain the suppression of testosterone. And in this graph later, after the end of treatment at 49 weeks, we conducted a follow-up for 90 days where we studied the testosterone concentration recovery in the patients. So it can be seen that in case of Leprolide, the testosterone came back to its normal level, which is 220 nanogram per deciliter, but in case of Leprolide, it didn't achieve the normal level. So if we discuss the safety and efficacy profile of the both drugs, we have come to decision that oral daily treatment, which is Orgovex, is effectively and rapidly suppressing this level of testosterone, and this safety analysis shows that the cardiovascular events are very low as compared to the leprolide. So, in case of leprolide, the patient had to go to the clinical setting, but in COVID-19 era, it was difficult for the patient. So, I'm going to conclude because I have short time. Precision oncology is promising in optimizing treatment strategies, improving the outcomes, and increases the quality of life of patients. Thank you so much.
Assalamu alaikum. I'm Hafsa Ijaz. My group members are Mubashra Saeed, Aruj Anwar, Amna Farooq, and Aisha Saeed. Look at the poster. The whole background is just covered with the piece of cloth, and some nanoparticles are trying to incorporate into it. Why is this phenomenon happening? Let's find out. Because we are trying to load cardiosan-based nanoparticles containing antibiotics or antibacterials in the cellulose-based fabrics. Why? Because we want to increase the antibacterial activity of these fabrics. We know that the chitosan is a natural polymer that is used as efficient drug delivery system to the specific organs without causing any resistance. We know that the textiles can cause cross-infection if we do not treat them with the biocidal agents. That's why our objective of study is we are preparing biocompatible chitosan nanoparticles loaded by tetracycline, gentamicin, and ciprofloxacin as novel drug delivery system for improving the antibacterial properties of cellulose-based fabrics. The method we have adopted, we have prepared chitosan-based nanoparticles with modified inotropic gelation method. Then we prepared antibiotics, loaded them into these nanoparticles. Then we finished our fabrics with these nanoparticles and assessed their antibacterial activity with the disc diffusion method. In the results, we are looking at the FTIR spectra that is showing us the presence of all these three antibiotics loaded in the chitosan-based nanoparticles into the cotton sample. Black peaks are showing us the presence of untreated cotton fabric contents. Red one are showing us the chitosan-based nanoparticles containing ciprofloxacin, green one containing tetracycline, and blue one containing gentamicin into it. Why I'm saying that here cotton contains? Because we know that cotton is containing 96% cellulose into it. Now look at the last graph. We are looking that there are two samples. The front columns are showing us a sample, a piece of cloth that is treated with the chitosan-based nanoparticles containing ciprofloxacin, and the columns at the back side are showing us the sample, a piece of cloth that is just containing ciprofloxacin. By comparing both the sample, we can conclude easily that inhibition zone is increasing as the concentration of ciprofloxacin increasing, but more efficiently in the sample where we have incorporated the ciprofloxacin in the form of chitosan-based nanoparticles. If we are using antibiotics even in the clothing, then we may think that it can cause more resistance in our body against these antibiotics. But the answer is no, because the chitosan is actually cationic in the acidic medium due to the presence of amino group. It penetrates into the membrane of the bacteria and kill the bacteria and do not allow them to cause resistance against the antibiotics that are loaded in the chitosan-based nanoparticles. So in the discussion, we will discuss that the results were according to our expectations, and these antibiotics inhibit the gram-positive and negative bacteria. FTIR spectra were according to our expectations, and the scanning electron emission analysis has shown us that the untreated cotton is showing us the growth of bacteria, while the treated cotton sample is in fine quality and there is no growth of bacteria. So we concluded that this experiment was very successful. Results were according to the expectations, and we can use this method to increase the antibacterial capacity of these cellulose-based fabrics and have many other biomedical applications as well. I would like to acknowledge that I am feeling very grateful that my university has provided me opportunity to present this poster under the kind supervision of Sir Malik Hassan Mahmood and Sir Liaquat Hussain. The reference of my articles is actually a research article of some researchers of Textile Research Division of National Research Center, Egypt. This is actually a research article of these researchers, and I have reviewed their research articles. And I'm hoping that if they find this review somewhere, they feel it convenient. Thank you so much.
This is Group 5. My name is Akshay Ahmed from MPhil first semester. Sadr Wasim, Farwa Rashid, and Aiba Saeed are also included in this group. The topic of my poster presentation is novel pharmaceutical approaches in dementia. Let's talk about introduction. What is dementia? Dementia is a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with daily life. There are 6 types of dementia: Alzheimer dementia, vascular dementia, frontotemporal dementia, mixed dementia, and Lewy body dementia. Dementia is an acquired cognitive decline of 6 discrete cognitive domains, including complex attention, executive function, learning and memory language, perpetual motor function, and social cognition, currently classified as major neurocognitive disorders. Cause of dementia remains unknown, and increasing age is a risk factor of dementia. What is the objective of our study? The aim and objective of our study is clinically approved drugs for other illness are repurposed for their possible efficacy against dementia by passing a lengthy period for preclinical testing and assessment of the drug safety. Material and methods. Acetylcholine esterase inhibitors are prescribed for patients with mild to moderate Alzheimer's diseases which leading to dementia. Donepezil tablets are initially used as a choice of therapy because they have low cost. Memantine, which is antiviral drug, has potential interest for the treatment of SARS-CoV-2 infection, which is also used in Alzheimer patients and dementia patients who didn't respond to acetylcholine or acetylcholine esterase inhibitors. Combination therapy of approved drugs has been explored for high efficacy for dementia treatment. Retrospective studies show that galantamine-memantine combination significantly improved cognition of patients with Alzheimer's disease and dementia compared to donepezil-memantine combinations. Combination therapies showed similar tolerability and safety compared to monotherapy. Observations include that we observe combination therapy is more effective and safety profile as compared to monotherapy. Let's talk about the graph and tables and results of the combination therapy and monotherapy significance. Firstly, we use galantamine plus memantine in combination therapy in mild cognitive impairment patients of Alzheimer's diseases and dementia patients. The result is superior to galantamine. Galantamine is more superior than memantine. Secondly, we use galantamine and memantine in a combination therapy for Alzheimer's disease patients, but we see no improvement in cognition. And then we use a combination therapy in case of galantamine and memantine in Alzheimer's disease patients and dementia patients, but donepezil is superior to galantamine and memantine, and there is no efficacy. Acetylcholine esterase inhibitors and memantine we use in combination for mild to moderate Alzheimer's disease and no additional benefit. Secondly, we use acetylcholine and memantine in a combination therapy for moderate to severe Alzheimer's diseases and dementia patients. Improved cognition, behavior, symptoms, and activities of daily learning are improved, and we see more effective and combination and safety of these profile and when we use in combination. Graph shows that monotherapy is effective in Alzheimer's disease patients, but the combination therapy like galantamine plus memantine, acetylcholine esterases, and memantine are more effective as compared to monotherapy. And we see improved cognition, behavior, symptoms, and activities of daily living. In last, we are very thankful to hospital staff for their cooperation in our research. The result of our study is that the combination therapy is more effective in dementia treatment as compared to monotherapy. And acetylcholine, memantine are clinically approved drugs for different causes and for different diseases, but we use them in dementia treatment because they have a novel benefits, they are novel drugs, and they are included in novel approaches in pharmaceutical dementia. They are novel pharmaceutical approaches in dementia.
हमारा टॉपिक है रोल ऑफ कैडमियम एंड आर्सेनिक एज एंडोक्राइन डिसरप्टर्स इन कार्बोहाइड्रेट्स मेटाबॉलिज्म. एंडोक्राइन डिसरप्टर्स ऐसे केमिकल होते हैं जो हमारी बॉडी में एंटर होते हैं और उनकी लिपोफिलिक नेचर की वजह से हमारी बॉडी में इनकी एब्जॉर्प्शन बहुत आसान होती है। कैडमियम और आर्सेनिक ऐसे ही दो एंडोक्राइन डिसरप्टर्स हैं जो हमारे कार्बोहाइड्रेट्स मेटाबॉलिज्म पे बहुत अहम किरदार अदा करते हैं। ये कार्बोहाइड्रेट मेटाबॉलिज्म को इस तरह इफेक्ट करते हैं कि हमारे पास बॉडी में ग्लूकोज के लेवल हाई हो जाता है और इस हाइपरग्लाइसीमिया की वजह से डायबिटीज मेलिटस हो जाती है। तो सबसे पहले हम देखते हैं कि कैडमियम और आर्सेनिक हमें कहाँ से हमारी बॉडी में आ रही है, उसका एक्सपोजर देखते हैं। तो सबसे पहले सबसे इम्पोर्टेंट जो उसका सोर्स है वो हमारा फूड है। आर्सेनिक नंबर 1 और कैडमियम को हम नंबर 7 प्रायोरिटी लिस्ट में रखते हैं, जो कि हमारे फूड से आ रही है हैवी मेटल्स की पॉइजनिंग में। उसके अलावा हमारे पास स्मोकिंग, वो जो सेकंड मेजर काज ऑफ कैडमियम पॉइजनिंग। उसके अलावा कॉस्मेटिक्स में आर्सेनिक और कैडमियम का लेवल काफी हाई होता है। और सबसे बढ़कर हमारे ड्रिंकिंग वाटर में कैडमियम की अमाउंट बढ़ती जा रही है, जिससे कैडमियम टॉक्सिसिटी के चांसेस बढ़ रहे हैं। अब हम आर्सेनिक और कैडमियम की ग्लूकोज मेटाबॉलिज्म पे इफेक्ट की बायोकेमिस्ट्री को देखते हैं। सबसे पहले ग्लाइकोलाइसिस में इन दोनों हैवी मेटल्स का क्या रोल है। कैडमियम फॉस्फोफ्रुक्टोकाइनेज वो एंजाइम है जो हमारे ग्लाइकोलाइसिस में सबसे इम्पोर्टेंट रेगुलेटरी एंजाइम है। तो ये उस एंजाइम को इनहिबिट कर देते हैं बाय बाइंडिंग टू सिस्टीन सल्फाइड्रल ग्रुप। इस एंजाइम की इनहिबिशन की वजह से ग्लाइकोलाइसिस रुक जाती है और हमारे पास बॉडी में ग्लूकोज का लेवल हाई रहता है। इसके साथ आर्सेनिक हमारे पास आर्सेनोलाइसिस के प्रोसेस के थ्रू कुछ एंजाइम्स का फॉस्फेट के साथ रिप्लेस हो जाता है। तो वो एंजाइम और आर्सेनिक का कॉम्प्लेक्स एक ऐसा इनहिबिटर है जो कि ग्लाइकोलाइसिस को रोक देता है। उसके बाद हम ग्लाइकोजन ब्रेकडाउन यानी कि ग्लाइकोजिनोलाइसिस में कैडमियम का रोल देखते हैं। कैडमियम हमारे पास ग्लाइकोजन फॉस्फोराइलेज की इनहांसमेंट कर देती है, जिसकी वजह से हमारे पास ग्लाइकोजन की ब्रेकडाउन बढ़ जाती है और इससे मजीद ग्लूकोज का लेवल हाई हो जाता है। और इसके अलावा आर्सेनिक भी हमारे पास ग्लाइकोजिनोलाइसिस को प्रमोट करता है, जिससे मजीद ग्लूकोज का लेवल हाई हो जाता है। और इस हाइपरग्लाइसीमिया की स्टेट की वजह से, जो कि हैवी मेटल्स की वजह से हो रही है, इसको हम सेकेंडरी डायबिटीज मेलिटस कहते हैं। तो ऑलरेडी डायबिटिक पेशेंट में इन हैवी मेटल्स की पॉइजनिंग काफी डिजास्टर्स होती है।
Assalamu alaikum. I am Anliba Tayyiba and I am from pharmacology student. Today I am going to discuss about the anti-Parkinson evaluation of Brassica junica leaves and its underlying mechanism of its phytoconstituents. As we all familiar with the Parkinson disease, it's a second most common neurodegenerative disorder. Oxidative stress helps to regulate neurodegenerative and neuronal dysfunctioning. From centuries, natural compounds are being used to attenuate the oxidative stress in a variety of neurological disorders. The plant which is under discussion was Brassica junica, which was obtained from northern areas. It is a rich source of antioxidants. So the purpose of this study was aimed to evaluate the therapeutic potential of Brassica junica leaves for the treatment of Parkinson disease. For this purpose, we prepared methanolic extract of leaves, and in vivo and in silico studies was performed. For this purpose, we took 36 rats and divided into 6 groups. First group was the normal control group. Second group was the disease control group, in which we gave haloperidol 1 mg per kg to the rats. Third group was treated group, in which we gave levodopa and carbidopa to the rats. And fourth, fifth, and sixth group was the treatment control group, in which we gave our treatment doses at 200, 400, and 600 mg per kg to the rats. As a result of the in vivo study, showed the improved behavioral and biochemical analysis. Dopamine level was also increased and monoamine oxidase inhibitors was decreased. Molecular docking analysis of constituent showed that constituents have good result in terms of protein ligand binding interactions as well. So that's all about my topic. Thank you so much.
Assalamualaikum. I am Zuhaira Rakhtawa from the MPhil Pharmacology and I am here to describe you about the anti-Parkinson's activity of Cratulus terrestris via the modulation of the acetylcholine, alpha-synuclein, tumor tissue necrotic factor alpha and interleukins. This plant belongs to the family Zycophyllaceae and it has different phytochemical analyses were performed. Phytochemical analysis indicated its medicinal importance against the neurodegeneration due to the existence of steroidal saponins, alkaloids, flavonoids, steroidal glycosides, and cinnamic acid and phytosterols, which are the main five constituents through which its activity is performed. It has traditionally been used in abdominal distension, leukorrhea, eye trouble, asthma, hyperlipidemia, hypertension, microbial infections, and milling. There are different reports have been published about this plant, and recent reports showed that saponins and flavonoids have remarkable neuroproductive activity in different diseases like Alzheimer's disease, stroke, and Parkinson's disease. This plant is collected from the West Canal Office Irrigation Department, Faisalabad, and then its drying is done. This plant is dried under the shade for 2 months, and after the coarse grinding, the fine powder has obtained by sieving by the sieving. The Tribulus terrestris methanol extracts was also be prepared, and these are prepared by macerating 2 kg of this powder in 5 liters of the methanol, fired for the 7 days with occasional shaking. And then the extracts will be filtered, passed through the rotated evaporator, and we will get the semi-solid extract. And there it has two main constituents. This is a rich source of the flavonoids and the saponins, which have been reported to have the neuroprotective effect and also the antioxidant potential. The current study has planned to investigate the anti-Parkinson's activity of this plant methanol extracts. It was hypothesized that TTME possessed antioxidant potential and can ameliorate the Parkinson's disease by the modulation of the synuclein, alpha-synuclein, acetylcholinesterase, tissue necrotic factor alpha, and interleukins. And to test this hypothesis in silico and in vivo studies were performed. This was performed in rat studies, and rats were divided into the 6 groups. And the first one is the control group, second one is the disease control group, and third one is the treatment groups. To which we give the treatment doses of this plant. And then for these our treatment doses are 300, 100, and 100 mg per kg for 21 days. Behavioral observation and biochemical analysis have done. Behavioral observations includes the different tests such as footprinting test and hang test, open field test, and grip walk test. And biochemical observation includes the determination of superoxide dismutases and glutathione, acetylcholinesterase activity, and malonyl activities. And different real-time PCR have also been performed. This shows that the muscular strength, locomotor function, stride length, and different improved studies. Endogenous antioxidant enzymes levels have also been decreased, and its research shown that down regulation in the messenger RNA expression levels by the of interleukins, alpha-synuclein, tissue necrotic factor alpha, acetylcholinesterase. In the treated groups, it is concluded that TTME has potential to ameliorate the symptoms of Parkinson's disease. Thank you so much.
My name is Vajiha Abid. I'm student of PhD Pharmacology and the group member who is also participating along with me in this competition. Name is Anam Iqbal. Basically, the current research was designed to observe the pathocurative effect of aloe vera gel and Majoon Dabidul War, which is the herbal Unani medication against paracetamol-induced hepatotoxicity. For this purpose, 45 rats were divided into 9 groups, each having 5 rats. One group was kept as control. The rat in other groups were administered with paracetamol, aloe vera gel and Majoon Dabidul ward once daily for 7 days. On 7th day, blood samples were collected from each group and analyzed to determine the biochemical parameters. Significantly improved. All the biochemical parameters were observed in rats treated with aloe vera gel solution and Majoon Dabidul ward, supported with histopathological analysis. Phytochemical analysis of both preparation indicated the presence of phytoconstituents. According to results of biochemical parameters, phytochemical or antioxidant analysis and histopathological examination, aloe vera gel solution and Majoon Dabidul ward exhibited significant hepatocurative effect. Thank you very much.
Reza from PhD Scholar. My topic is on the antiviral ambrotoxics and cytotoxic activities of Astralis membranous root extracts. In this study, I take the Chinese plant, which is Astralis membranous. I check the antiviral and cytotoxic potential as well as ambrotoxic potential against avian influenza H9 virus. For the antiviral activity, I take the plant and make its different extracts as well as aqueous and methanolic extracts and prepare its doses. The doses ranges are 400 microgram per ml, 200 microgram per ml, 100 microgram and up to 3.12 microgram per ml. So after preparing the doses, I check its antiviral activity. For the antiviral activity, I take the virus, which is avian influenza H9 virus from the UAS. For its antiviral activity, for its antiviral activity, 8 different concentrations of the plant extracts, aqueous extracts, mix the extract with standard concentration of the virus and incubated for 30 minutes at 37 degrees centigrade for antiviral activity. Each of the virus and the extract mixture was injected in 9-day-old chicken embryos procured from high-tech laboratories Lahore using allantoin cavity route under sterilized condition. So inoculated eggs were incubated, and after incubation, the eggs were harvested, and after harvesting, their chorioallantoic fluid was collected in sterilized test tubes to check the presence of virus using spot hemagglutination and microdilution method for the growth of. So if the spot hemagglutination test positive, it means virus is present and there is no antiviral activity of the plant extract. So for its ambrotoxicity, I checked my both extract without virus were inoculated in the chicken embryos. Embryo mortality caused by extract was recorded for 3 days. Its cytotoxicity is checked on BHK21 cells in the form of monolayer against both extract against both concentrations using cell survival percentage formula in the OD values. In my results, the concentration of antiviral activity 400, 200 and 100 microgram per ml. On these concentrations, the antiviral activity of the extracts appear, and there is no ambrotoxicity of both extracts on the embryos. And for the cytotoxic concentration, 400 microgram per ml, on this concentration the cell death appear, and concentration of aqueous extracts are the safe for the cytotoxicity. For the methanolic extracts, 400 microgram and 200 microgram extract show cytotoxicity. So I concluded that aqueous and methanolic extracts of Astralis membranous can safely be used as a therapy of infections caused by avian influenza virus in poultry. However, further studies are required to investigate actual active ingredients of Astralis membranous having antiviral activity. So it's my study. Thank you, sir.